Well, good evening. Mental illness was a factor in South Dakota's most recent officer-involved shooting.
Investigators say the man was carrying knives and approaching officers when he was shot. According to the National Alliance on Mental Illness, people with serious mental illness are more than 10 times more likely to experience use of force in interactions with law enforcement.
KELOLAND's Dan Santella takes a closer look at how the Sioux Falls Police Department works with someone experiencing a mental health crisis.
Tom, according to NAMI, when someone experiences a mental health crisis, they may seem hostile. Their symptoms can also interfere with their ability to respond to commands that can cause tensions to escalate even more.
On Thursday afternoon, law enforcement went to serve or execute a warrant for a mental illness hold. That after an extended period of discussions, it elevated and escalated.
The situation unfolded outside Southeastern Behavioral Health's Cayman Court, an assisted living center for people with severe mental illness. Investigators say the person had 2 knives and deputies needed backup, so they called police.
Numerous attempts were made in negotiations and communications to get him to drop the knives, and those were unsuccessful.
Chief Toombs says they tried using a non-lethal weapon, but it didn't work. And when the man made a move toward officers, he was shot.
One of the first things that we ask officers to do after they've determined that the scene is safe is to start bringing those emotions down.
Sergeant Tara Walton says 40% of Sioux Falls police officers are trained to respond to a mental health crisis.
Listen to the person, be empathetic to what's going on. There are some officers that have some specialized training in the area. So obviously, if we have one of those available, we'd ask them to respond.
Those skills can not only de-escalate a situation, they have the potential to save lives.
The strong majority of all officer-involved shootings involve some type of either mental illness or drug use, and at times a combination of each.
South Dakota's Division of Criminal Investigation is investigating Thursday's officer-involved shooting. A report is expected in less than a month.
Thank you, Dan. Now, to get a better idea of just how often mental illness plays a role in officer-involved shootings here in South Dakota, we took a look back a year. In 2023, the Attorney General's office investigated 7 officer-involved shootings, and at least 2 of the incidents involved mental illness, where people told police to shoot them or said that they wanted to die. All 7 of the people who were shot tested positive for drugs or alcohol. In some cases, the levels were dangerously high.